Hello there. Today we will be learning about HIV and AIDS.
Ooh.
What is that?
Good question. First move out of the way. The HIV virus, in which HIV means human immunodeficiency virus, is the pathogen that leads to AIDS, which stands for acquired immunodeficiency syndrome.
Boring.
Well, if you think HIV is boring, it infected a total of 78 million people and 38 million died of it.
Say what?
On the bright side, the estimated 1.5 million people dying from HIV globally in 2013 were 22% fewer than in 2009 and 35% fewer than when the number peaked in 2005.
Is there a way to get rid of this virus?
No, there is no cure for HIV, but strict adherence to antiretroviral regimens, ARVs, can dramatically slow the disease's progress.
But why is that? Did we anger Mother Nature? Oh, I shouldn't have killed that flower.
The reason is, because HIV is a rapidly mutating virus. Here is what I mean.
Hey look, I made a cure for HIV for patient number 666 and injected the cure into him. I saved a life.
Sorry mate, the virus already mutated to defend against your cure.
Okay fine, but how do I know if I have HIV?
During the first stage of HIV, 2 to 4 weeks after HIV infection, you may or may not feel flu-like symptoms. Flu-like symptoms include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms can last anything between a few days to a few weeks.
Oh my god, I had the chills and night sweats a few days ago. I have HIV, I'm going to die.
Stop worrying. Other illnesses could cause the same symptoms you have. If you think you have HIV, take an HIV test. Anyways, after the early stage of HIV, it moves into a stage called the clinical latency stage. At this stage, HIV reproduces but at low levels. At this stage you probably won't feel anything at all, or just mild symptoms. After a while,
Many months later.
HIV starts making you progress to AIDS. Now symptoms can be rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. But then again, to make sure you really have HIV, take an HIV test.
Okay, but how do I prevent HIV in the first place?
The best way to not get HIV is not to catch it, or play catch with him.
So how do you get HIV then?
Well, HIV is transmitted through all body fluids, like blood, semen, breast milk, etc. So ways you can get HIV is, if your mother transmitted it to you during pregnancy, have unprotected sex, sharing needles, and sharing blood. So ways you can protect yourself against HIV is to only have protected sex, or don't have it at all, don't share needle and blood, and just don't share any bodily fluid.
Is there any HIV organizations out there?
God, what is what with you and questions? Anyways, yes, there is HIV/AIDS organizations like AMFA, which invested $415 million towards programs, which goals are to support AIDS research and treatment education. AMFA pioneered research that ultimately led to the use of antiretroviral drugs to block mother-to-infant HIV transmission. They also funded research leading to the first three-dimensional images of HIV both before and while it makes initial contact with susceptible cells, information that could be used to design new vaccine and drug treatment candidates. Of course, there are other organizations like AIDS United, the International AIDS Society, and more. Before we move on, here is a video about the history of HIV/AIDS.
HIV is a deadly virus that causes acquired immunodeficiency syndrome, or what's commonly known as AIDS. It popped into existence in the early 1980s, but where did it come from? At first, the Center for Disease Control conducted a study that placed one man at the center of this epidemic. The 31-year-old Canadian flight attendant became known as Patient Zero for AIDS. At a time when gay culture was largely illegal, the public soon blamed him for starting the disease. Scientists, however, suspected that he couldn't be the first human to get the virus, and so they started collecting samples of HIV from multiple patients inside the US. They soon discovered that the disease has been evolving in the US long before patient 0 could have ever been infected. In order to find the origin of the disease, scientists also looked at tissue samples from the past, which doctors had preserved from patients who had died strange deaths. Primitive versions of HIV were found in several human samples, and scientists started examining different strains of HIV to find a connection. One researcher found a strain of a chimp virus that was almost identical to a human strain found in Africa. The strain was a virus called SIV, which is a common virus among many species of chimpanzees. The leading hypothesis says that an infected hunter would have visited or moved to a large city in the early 1900s, where prostitution and sexual contact would have been easily found. And while it is clear that the few strains of HIV descend from SIV, some loose ends remain unresolved.
Now that we are done with that history lesson, it's question time. Question number 1. How many people HIV killed according to this video? 10, over 9,000, 38 million, or 1.12 billion people? No, you silly goose, the answer is 38 million people. Next question. Question number 2, which is a way you can get HIV? Water, bodily fluids, clouds, or
magic.
If I was you, I would have gone with bodily fluids. Last question. What does HIV stand for? Human infovariety, human immunodeficiency virus, helium isotope virus, or hello I'm very. You still answered all the questions wrong. The answer to this question is human immunodeficiency virus. Anyways, before we end off, we wanna thank our sponsors AIDS.gov, CDC.gov, and WHO.int.